Good evening, my name is Carey, and I've been a member here for about 5 years, and it's my first nomination, so I'm really excited. As a mom of 3, ensuring my kids have access to mental health skills is very important. So what stood out to me about Common Compass is that they're working to be proactive, so something I find our healthcare and education systems just aren't able to accomplish. One of the best things I think we can do is start teaching these skills early so that this new generation is able to better cope with their world, allowing them to thrive. So I've seen firsthand Common Compass already does a lot with very little, and I'm just so excited to see what they can do with this donation, should they be awarded. So I'm going to turn it over to Leisha, the founder of Common Compass. Thanks, everyone.
Thank you. And can I get the slide to go to the next one? Perfect, thank you. Okay, so I swear I had this planned from the beginning, but show of hands, how many of you had an easy time in high school? Easy time. Okay, so there's a few lucky people in the room. For the rest of us, maybe not a walk in the park. Different question altogether. Show of hands, how many of you know of a child who has struggled with accessing the right social, emotional, or mental health support when they needed it? Okay, so look around, almost everybody in this room. We know this, you know this, our community knows this, right? Especially since the pandemic, the rates of mental health challenges amongst children and youth have skyrocketed. And we know that schools are at the front line of these challenges. We know that they're dealing with behaviors like kids wandering in the hallways, they're vaping, fighting. Some of them are not able to actually get out of bed in the morning because they are so riddled with anxiety or depression. So it is very, very severe. And at the same time, 91% of Ontario school principals say that they do not have the resources to be able to meet the needs of kids. There's like one social worker for like 4 schools, and it just ain't cutting it. And you know, we know that when this support is not available early, challenges can deepen. It affects learning, it affects confidence, the relationships, and long-term well-being. And that is why Common Compass exists. We partner with schools to deliver evidence-based mental health skills training for students. So what that looks like is we partner with schools and develop really customized trainings for students, kindergarten through to grade 12. We also train the teachers in the school so that they are better able to support the kids themselves. And we also work with parents, because parents are the first teachers and the most important teachers. So we really provide holistic support to school communities to really move the needle on mental health challenges. Now let me tell you about 2 students. So first, I want you to close your eyes for a second. I'm going to do a little visualization. And I want you to imagine a 14-year-old girl, okay? Let's call her Izzy. Okay. She's what they call a high achiever. She's actually highly anxious. She gets overwhelmed easily. She's on student council. She's on the swim team. And everybody thinks she's doing just fine because she's at the top of the class. Her parents, her teachers. But what nobody knows is that underneath that hoodie are deep cuts. She has been cutting for a while as a way to release emotions of not feeling like she's not good enough and perfection that she can never achieve. She does not have any positive coping strategies. And one day her English teacher pulls her aside and says, "Listen, Izzy, you gotta calm down." And she kind of looks down and she doesn't know what to do with that information. She feels super awkward and avoids this teacher altogether. Izzy really struggles throughout high school. She doesn't find the support that she needs. And fast forward, it takes something pretty catastrophic for her to be able to access the support she needs, and it's not until her mid-20s. Now, instead, let's turn our attention to a different student, Rowan. Now, Rowan lingered in the hallway right outside the library where we had run a student mental health training with his class. And he said, Miss Leisha, that's what they call me, it makes me feel really old. He said, I've never knew that it was anxiety, like that feeling that I've been feeling as long as I can remember. And for the first time in a long time, I feel like I could connect with other students. I didn't feel so lonely. And I feel like I have some ideas, some strategies, so when the stress bubbles up, I can cope with it better. But what stood out most for me in that moment is he was telling me about an activity that we did earlier in the day when all the kids had to pick out a strength that they had. And he told me he picked one out, and it was brave. And for the first time, he had looked back on his life and thought that he was brave for the first time. And to me, that was profound. When you choose to give to Common Compass, you're giving so much more than mental health skills training to students. We're talking about emotional regulation skills, self-advocacy, perspective taking, and more. You're creating safe spaces for students like Rowan to recognize their struggles and find their voice, and these can be life-changing moments. Your generosity helps these stories be possible, and $10,000 will mean 500 more students like Rowan here in Halton that will have support. And the fact is, we need this support now. The need for school-based mental health is growing faster than available services. And I can tell you, I'm on the phone every single week with the school principal who desperately wants our programming, and we do not have the funding to support them. So I invite you to stand with me and consider joining more Rowans, creating more Rowans instead of Lizzie. Thank you.
Okay, questions? Yep.
How many schools are you in right now?
So, question is, how many schools are they in?
Thank you for asking. Right now we're doing in-depth projects with 22 schools. And so what that means is when we start work with a school, we actually take time to do a needs assessment of that school. So what are they already doing? What is the principal's understanding of mental health and the landscape? What are the strengths? We also take time to do focus groups and survey the students themselves because their voice is really important too. And then we develop tailored training and workshops for the students, the staff, and the parents in the school community based on the school's needs. So it's a really kind of longer term partnership rather than just like parachuting in and saying, see you later.
Do the principals invite you in? Do parents ask you to approach the principal? What way?
Both. Yeah, it's a little bit of everything. I'm a mother of 2 boys myself, and talk to a lot of other mothers. But we have had the great pleasure of working across 8 school boards, and so we're now at the point where we're approved partners of a number of school boards, and principals talk to each other, teachers talk to each other, parent councils talk to each other, and so there's lots of folks reaching out to us as well.
And you've approached the Halton board?
Yes.
Yep.
Yeah.
Where is your other funding coming from?
That is a great question. Oops, sorry.
So the first question was who invites them in, she answered, and the next one is where's their other funding coming from?
Yeah. So combination, so Common Compass is a registered charity, and we operate as a social enterprise. So the majority of our funding, about 70%, comes from fees that are paid by schools, never students themselves, never parents, but schools themselves. And as you can imagine, the state of public education in Ontario is very challenged, and it's making it a lot harder for schools to be able to access resources. And it's really important for us to be able to make sure that our resources are accessible to every school that needs it. And so we're having to do a lot more fundraising like this year over year to be able to make sure that our programming is available. And so we do a big grassroots peer-to-peer online campaign every spring, and we get a lot of individual donations. We do not get government funding. It's very challenging. We apply to a lot of grants, but as Nelson said earlier, for like every grant that you apply to, there's 1,000 other charities that need those funds just as much as you do. So it's very, very difficult to access the funding that we need.
So do the students sign up for these sessions, or are they identified by, say, like the parents or the teachers? I'm just trying to understand like what's like step one.
Great, sorry.
So Huda was just asking, do the students sign up for these, the needs that they have? Is it parents? Like, how does the first step start?
So the answer is it depends on the school. So we truly believe that there's no two schools that are the same. They have unique dynamics, strengths, and challenges. They could be across the street and have completely different needs. And so in one school, that might be where we run sessions and students self-select to sign up for particular supports. In another school, it might be we are working with the entire grade 9 cohort of the school, and we are doing kind of class-based sessions. And in other schools, it's kind of other models, but I would say those are the most common. Sometimes we also work more with the guidance team at the school, who specifically kind of identifies a group of students. There was a middle school last year that we were working with, and they had identified that there's a group of about 20 young people who are just really not engaged in school. They just really had a hard time getting them in the building, through the doors, and they really had low self-esteem. And so we were able to kind of work with the school collaboratively, which is like what our MO is. We want it to be deeply collaborative. Recognize those students, and we put together some really unique sessions for them to strengthen their sense of self-esteem, self-identity over time, and they had some really profound differences over the course of the sessions with them. And we framed it as a leadership program, because if you're a kid, you're not going to come to something that says, raise my self-esteem, right? But what are we talking about? It's about leadership skills in that particular context.